Problem-based learning, or in short PBL, students use triggers from the problem case or scenario to define their own.
Problem-based learning is used in many medical schools in the United Kingdom and worldwide. The method of learning and teaching is in small groups and explain why it has important impact in medical education. In problem-based learning, or in short PBL, students use triggers from the problem case or scenario to define their own learning objectives. Subsequently, they do independent, self-direct study before returning to the group to discuss and refine their acquired knowledge. Thus, PBL is not about problem solving, but it uses appropriate problems to increase knowledge and understanding. However, PBL is not really happening in clinical years. After 2 years of the predictable life of lectures, textbooks, and exams, the students are plunged into the world of actual clinical medicine, where patients and their illness rarely go by the book. It is the moment these students have been waiting for. One would think that the third year of medical school will be a crowning achievement, the donning of a white coat, the grasping of the golden ring after many years of striving. However, there is a darker side of this transition to clinical medicine. Many qualities that students entered medical school with altruism, empathy, generosity of spirit, love of learning, high ethical standard are eroded by the end of medical training. For starters, the entry into the clinical world can be an intensely disorienting experience. Complications, drug interactions, patient idiosyncrasies, medical errors, insurance issues, and emergencies keep life frenetic. Everything from the smell of infected pet sores and the insistent clanging of alarms to the foreign language of hospital.
Medical students entering the clinical years, specifically the surgery posting, may have encountered challenges in doing this posting. The extensive practice on one procedure or with a particular surgical device is limited in our country. All the essential surgical devices are only available for the real surgical procedures, especially when there will be tons of cases of accidents and trauma every day.
Malaysia lacks professional medical officers to teach medical students the knowledge they need to acquire, especially when it comes to surgery. Senior doctors and medical officers often are too busy to attend to the questions medical students has. So hence, we came up with this idea, a device actually, that hopefully will serve as the solution to this problem.
So, how does this system actually help medical students or personnel? Our VR system allows medical students to experience the surgery on a first-person basis, from handling a scalpel, excision of a tumor, stitching a gaping wound, endotracheal intubation, to placing a stent in the cardiac arteries. All of these single details of a surgery are included in our VR system. This software can be used for students to revise the steps and also the details of various surgery before exams or lessons. The software also comes with test mode to allow self-assessment of the students. Universities also no longer have to pay patients to attend medical examinations, nor do they need to acquire cadavers from the hospitals, as all of this can be done via our virtual reality software.
First and foremost, our device includes input from professional doctors, specialists, and also surgeons worldwide. Hence, our device provides an unparalleled level of accuracy and realism to any surgical procedure.
Why is our software important? First of all, virtual reality creates a better practice environment. Simulation has been proven to be particularly effective when it's come to teaching highly technical procedure, especially if it is a procedure that doctors rarely perform but must know how to do well.
Secondly, our virtual reality software allows more immersive training and textbooks. Virtual reality allows students to watch a procedure in the comfort of home or anywhere they like. This definitely offers a more conducive learning environment and also yield better learning outcomes compared to the traditional method of surgical students crowding around an operating room table to watch a procedure.
It reduces the risk of mistakes and increases the survival rates of various surgical procedures. Medical students can afford to make mistakes and learn from it in the VR setup where there is literally no risk at all.
To make it simple, if you're having problem in coping the medical life, especially during the clinical years, our VR system might be a good help for you. So just grab it, wear it, and you feel the study environment everywhere, anytime you like. So thank you for supporting us, and hope to see you guys in the next video.